Simon Cowell, what happened to his face? In 2001, age 42, Simon's look is defined by a strong jawline, low hairline, and a natural masculine brow. Notice the subtle hooding of his upper eyelids and a hint of under-eye hollowing, and these are the first signs of facial aging, and they matter as we follow his journey. 2002, age 43, well, here we can see some mild jowling and a little neck fullness appear. Now these are early classical signs of facial and neck aging. There's nothing unusual, but they're important as markers as the years go by. 2003, age 44, well, now the natural lateral brows has begun to drop. This descent is a hallmark of aging, caused by gravity and weakening of the brow lifting muscles. It's subtle, but it sets the stage for future changes in his appearance. Simon, it looks likely that he starts using Botox in his forehead and glabella area between his eyebrows. He's spoken about going a bit overboard with fillers and Botox. This is actually a common story that I hear. Many celebrities have crossed that line from going from subtle to slightly overdone without realizing it. 2009, age 50, suddenly his cheeks look much fuller, and this is likely to be the result of dermal fillers. Now, some volume can rejuvenate, but too much volume can blur that line between natural definition and looking overdone. 2010, age 51, well, now the outer corners of his eyes drop below the inner corners, and this change can make someone look more tired even if they feel great. 2012, age 53, Botox is more striking, especially in the way that his lateral brows look to arch. There are also more changes in the signs of his neck, with more fullness and more suggestion of laxity in the neck area, often with skin and some of the underlying muscle. 2015, age 56. Now there's some evidence of brow ptosis, sagging of the brows overlapping towards his eyes. Now this often becomes more pronounced with facial aging, and this can also be caused by repeated Botox that can also cause drooping in this area. His upper eyelids have more skin, and his vision may even be affected by this. There's also some evidence of cheek and under-eye fullness, which may be a result of fillers. 2020, age 61, well, there's evidence now of changes in the neck. We can see some evidence of bands in the platysma, vertical necklines that are starting to show, and these can be the classical signs of muscle separation and skin thinning in the neck area. Simon announces that he's dissolving all his fillers. He even admitted that his own son has been scared to look at him. Now, sometimes less is definitely more, and reversing treatments can be the best way forward. Dissolving fillers can also thin tissues if it's not done carefully, but often it's the best way, and I've dissolved many patients' fillers, particularly around the under eye and cheek area, and often we can do things like fat transfer that will look more natural. September 2022, age 63, Simon's look has changed dramatically. There's likely been a lateral brow lift, possibly upper and lower eyelid surgery, also known as blepharoplasty, and possibly tightening of the corner of the eyelid that is called acanthus and sometimes called canthoplasty in medical jargon. His upper eyelids actually look more hollow, which can mean that there's been aggressive eyelid surgery and removal of skin and soft tissue such as fat, or sometimes there's been excessive elevation of the brow area. Photos and asking what has happened to Simon Cowell's face. And the debate highlights how even tweaks can sometimes be magnified in the public eye, especially for celebrities who are under constant scrutiny. 2024, age 65, smoother skin, tighter features, and a more refined jawline, and some attribute these to more non-surgical treatments like laser tightening, skin tightening treatments, while others suspect that there may have been a surgical approach. Simon himself remains candid about his cosmetic history, admitting he's moved away from having fillers and Botox and feeling he may have gone too far in the past, and now he wanted a more natural look. 2025, age 66, Simon's now on Britain's Got Talent, and this year Simon returns as a central judge. Viewers are also fixated on his appearance, calling him an AI version of Simon Cowell. Simon insists that he's done with fillers and Botox, and a bad experience left him looking like something out of a horror film. Now he stands by his decision to embrace a more natural appearance. Fine amounts are so important to maintain a natural appearance. Now whether he's embracing new treatments or stepping away from them, every change we can see because it's magnified by high definition cameras and filming. Why are these changes so noticeable? Well, major facial overhauls in men stand out because men often need more subtle, incremental tweaks. Less is definitely more in men. Sometimes it's better to stage procedures, and my personal opinion is I ask all patients to bring old photographs so we can use the old photograph as a template for planning any further treatments. Now here is a side-by-side comparison. The difference is dramatic, and it makes us think about what is natural balance and what is enhancement and authenticity. Simon Cowell's journey is a powerful lesson in facial aesthetics. It's about balance, restraint, and respecting your own natural facial characteristics. If you found this helpful, please subscribe and let me know your comments and thoughts regarding transformation, as I'll continue to give you insights into natural rejuvenation and how to maintain a youthful natural appearance in years to come. Thank you for watching.